These are the supplies needed for your reconstitution and your first injection. You will start by opening the 10 ml syringe with the needle attached. You then will have the normal saline, as well as the peptide, which will be lyophilized, which means in powder form when you first get it. You will pop off the top of the sterile normal saline, as well as pop off the top off the peptide. Then, using the 10 ml syringe, you will preload the syringe with 4 ml of air. This will help with pulling back the normal saline. Pop off the cap, insert the needle with the sterile normal saline, inject the air, and pull back 4 ml of the sterile normal saline. You will then try to flick out any air bubbles that you see. This may take some trial and error. Once you have the 4 ml, you then will place it inside of the peptide. The vial will have negative pressure, so the 4 ml will just inject itself directly. Cap your syringe, remove the needle, and place it inside the sharps. The syringe can now be thrown out. You now will gently swirl the peptide. Once the solution is clear, the peptide is ready to use. Next, you will clean the top of the peptide with an alcohol swab. Then you will clean the area of skin that you plan to inject. Now that both the areas are clean, you will use the syringe by uncapping the plunger and uncapping the needle. Your dose will vary based on the concentration of the peptide as well as how many mLs of normal saline you use to reconstitute. In this case, the dose that we are doing are 250 micrograms, which will be equivalent to 10 units on the insulin syringe. Again, try to avoid any air bubbles. Now, you will squeeze the area of skin that you plan to inject, and on about a 45-degree angle, you will push the peptide inside. Now, you will cap the syringe and place the entire thing inside of the sharps container. Once you are done, you will place the peptide in the fridge for future use.